hope. The inborn quest for scientific knowledge has resulted in the progress of mankind. The primary aim of such scientific endeavor is to improve the human environment and quality of life. Our aim is better care of the concerned couple, knowledge about their investigations, and further education of those who serve them. We understand that each patient undergoing infertility treatment is unique, and her treatment should reflect that with a wide range of available options in the field of assisted reproduction, empowering the patient with scientific information. We hope to create awareness, impart knowledge, and offer patient-friendly treatment options. With the rapid advances in the field of assisted reproduction, guidelines and regulations are needed to avoid its misuse. Infertility affects many couples. Up to 1 in 6 couples have difficulties in conceiving, and many seek medical advice and treatment. Some patients will need only advice or reassurance. Others may need drug therapy or surgery. But some will need to be referred to a clinic which specializes in assisted conception techniques. The main factors that determine the chances for pregnancy are the age of the woman, the length of the time that she has been trying to have a family, her previous ability to conceive, and the quality of the man's sperm. In normal fertile couples, cycle fecundity averages 20% and does not exceed approximately 35% even when coitus is carefully timed. That perspective is particularly helpful when discussing and comparing the efficacy of different treatment options, typically viewed in terms of cycle fecundability. When doing so, it is important for couples to realize that the benchmark for comparison is 20% to 30%, not 100%. Women become less fertile as they get older. The effect of age upon men's fertility is less clear. If you have not been able to get pregnant after 2 years of regular unprotected sexual intercourse, either one or both of you may have a fertility problem. Tests and investigations. If you and your husband have been trying to have a baby for at least 1 year without success, there are many tests which can be done to find out the reasons why. If the cause of your infertility has not been investigated previously, the clinic will carry out the necessary tests. These tests may include an analysis of the man's semen and the conditions of the woman's uterus, her ovulation status, the cervical mucus, and the condition of the fallopian tubes. If the tests have been done during the previous treatments, you should ask whether it is necessary to repeat them. Once the cause of the infertility is identified, the doctor will offer procedures available and initiate therapy as quickly, efficiently, and inexpensively as possible. For each diagnostic etiology, there is indeed a proper approach. Even after tests, some infertility remains unexplained. But that does not mean that it cannot be treated successfully. After a thorough examination, you and your husband will undergo a series of tests that require joint investment of time, money, physical and emotional energy. Evaluation and treatment does not mean success, but at least helps you understand the reason for your infertility better. Treatment options. A very important part of the treatment to begin with is lifestyle modification, and most important is stress management. Proper diet and relief of stress through yoga and meditation is important part of healthy living. As defined by WHO, health is a state of complete physical, mental, social and spiritual well-being, and not merely the absence of disease or infirmity. The options of treatment of infertility now available are IUI, IVF, gift, ICSI, blastocyst transfer, assisted hatching, PGD, adoption, DI. There are many possible causes of infertility or subfertility in both men and women. There are also many possible treatments. Drug therapy to control ovulation, surgery to improve blocked or damaged fallopian tubes, intrauterine insemination, IUI, using the husband's sperm, insemination using donor sperm, DI, if the husband or partner has no sperm or very poor sperm or has the risks of passing on an inherited disease. In vitro fertilization, IVF, egg donation with IVF, embryo donation, gamete intrafallopian transfer, gift, intracytoplasmic sperm injection, ICSI, IVF or ICSI with PGD, pre-implantation genetic diagnosis where there is a risk of inheritable disease, surrogacy. The Federation of Obstetric and Gynecological Societies of India, FOGSI, under the leadership of Dr. Suchitra Pandit, President FOGSI, and Dr. Rosa Olyai, Vice President FOGSI, is holding various CMEs and workshops this year to keep the gynecologists abreast with the cascade of developments in infertility management. The scientific program has been meticulously worked out. It is designed from basic to advances in the field of infertility, considering the interest of each and every gynecologist, trainees and students to enable them to cater to the need of the public, especially to the infertile couples in India. We hope that at the end of workshops, the delegates will go back with a take-home message from the discussions on the latest developments in the field of infertility management.